Hello everyone. My name is Simran Chaudhary and I welcome you all on behalf of Voice of Healthcare to Heart Matters 2025 Experts Insight for Every Beat on our special World Heart Day series. This year's global call reminds us to take heart health seriously and act early. Through these crisp, power packed sessions, we aim to bring you leading voices from cardiology and prevention medicine to help you and protect your heart and live a healthier life. To guide us through this important discussion, we are joined by none other than Dr. Aziz Kothawala, a highly respected interventional cardiologist with nearly 2 decades of experience. Dr. Kothawala is associated with Saifee Hospital and is known for his expertise in treating complex cardiac conditions with compassion and precision. His specialization include angioplasty, stenting, heart valve repair, and replacement bypass surgeries, advanced heart failure management, and even transplant care beyond clinical practice. He has contributed extensively to research and publication cardiology. We are honored to have you with us. Welcome to our show, sir.
Thank you. Thank you for calling me here in this show.
Thank you so much, sir, for coming to this series where we are basically, which we aim for the awareness and the education of our general public. So, to begin with, we are seeing that there's a rise of heart attacks, sudden cardiac arrest, and everything. But just for a layman's person, if a person actually needs to understand from the basics, could you explain this in very simple term what exactly is heart attack and what happens inside the body during this time?
So, heart attack is basically a demand supply mismatch which occurs at the level of the heart. So, heart requires blood to pump. So, heart also requires energy to pump the blood to whole of the body. So, people must be knowing that coronary arteries are the arteries of the heart which supplies blood to the heart for its own function. So if there are blockages in the coronary artery to a level that heart cannot take it, there is an heart attack. So heart attack is basically there is a breach in supply of blood to the heart for its own function, which leads to heart attack. So these coronaries starts blocking as early as age of 20 years, and if one is not careful about one's own health, these plaques gradually increase in size, and gradually they increase in size, and one fine day, if they are clogged with a clot that causes 100% occlusion of the artery, it terminates into a heart attack.
Thank you so much for explaining us that, sir, because it is very important to understand for our public, for our viewers to to know what actually happens in this case. So, in recent years, we are hearing more and more cases of young people experiencing heart attack. Even in their early 20s, early 30s, and so on. So, why is this happening, and what could be the major risk factors associated to this?
So the most important risk factor what I can see is it is the lifestyle changes what we are not adapted to, or what we have genetically not uh, we are not immune to those type of lifestyle changes. So like in the west, the diet pattern, the western diet pattern and Indian diet pattern is different. So we are now adopting their lifestyle pattern, like diet which is high in sugar and salt, and moreover sedentary lifestyle because of mechanization everywhere. And third is increased amount of use of illicit drugs and smoking and use of tobacco, and also the environmental pollution is to be blamed for this.
I truly agree, sir. I think the dietary habits, which is changing so rapidly, and also the pollution. I have also heard from the other experts saying that we don't understand the impact of pollution while we are standing in the traffic, or or the young population, those who are contributing major of their time while commuting to their workplace in the most polluted areas, and how it is affecting our breathing and it is affecting our arteries out there.
Yeah. So recent research have shown that the third world countries, underdeveloped countries, also have started having increased amounts of heart attacks in young because they are just accepting the Western style of living, which they are not used to it. Their genetics doesn't permit them to use that. So each and everywhere in the world, the genetics are different, the ethnicity is different. So you have to means abide by your own culture, and then that can prevent these type of lifestyle disease basically.
Rightly pointed out, sir, because our body is made according to where we belong, where we have been brought up, adaptable to all those
Yes,
situations. Moving on to my next question,
correct.
what could be, if you can educate and help us understand, what could be the early warning signs that people often ignore, but should, they should take immediate action and pay attention to all those signs?
So any young person, if he or she starts having breathlessness or a chest pain, retrosternal, on exertion, which she or he was not having before, should just click in our mind that there is chances of he or she getting an heart ailment. So they should just visit a doctor, show it to them, and just get cardiac evaluation done and rule it out for themselves. Many of the times people ignore it and consider it to be a part of acidity, which is the most common mistake. Sometimes people think that okay, they are not used to walking, that's why they are getting breathless. So that is the second mistake. So whenever you are having any problem like breathlessness or chest pain, especially on walking, and it subsides on rest, then you should see your doctor and you should get yourself evaluated. It is always to be overcautious rather than ignorant.
So can you hear me?
Yeah, I am able to hear you.
Okay, because I missed you while you were completing your last sentence.
Okay. So I don't know. So people should go to their to see a doctor in case if they have these types of symptoms on exertion, and rather than be ignorant, they should be cautious about it. So it's always better to check.
Very rightly pointed out, sir. I think nowadays, with the changing lifestyle and habits, it is it's better to stay cautious about even the small changes in our body, or normal day to day activity which we do, and need to consult our doctors immediately, so that we are up to date, that there's no fear, there's no need to think about what is happening, what is not happening. I think after a checkup, we all are relaxed if everything is normal.
Yeah, you get yourself cleared na, of doubts. It's always to be on the other side rather than be in the doubt okay, whether it is there or not. So get yourself cleared. If it is there, you have treatment for it. If it is not there, then you are relieved.
Yes. Yes. So, in your practice, you have decades of experience, almost 2 decades of experience. In your practice, you have treated, uh, many patients out there. But if I have to ask you, there could be a lot of misconceptions around heart health. So, what is that biggest myth you have heard the most from your patients?
So I would like to point a myth that people who smoke. So smoking is very injurious to health, very injurious to heart also, and usually the smokers are, I think, 10 times more likely to get an heart attack. So whenever a young patient with heart attack comes to us, the first question is whether you are a smoker. So then the myth comes came. So that other person also smokes so much and he doesn't get anything. Why am I getting this thing? So every person has a different uh, body makeup, genetic makeup, and therefore the smoke is injurious to health. maximum people. So very few of them are left. So it's only by chance that you may be left without anything. So maximum time you are caught. So it's always to be on the preventive side, not to smoke, rather than to say that somebody else is smoking, he's not getting anything. And so this is the myth, because smoking doesn't cause anything. uh, Another myth is people don't just go to the doctor in the fear that something will come out. So if I go to a doctor, he will test and he will find something or the other which is abnormal. So he or she, or the doctor doesn't want that something should come out from your body to be abnormal. So it is already there inside your body. And that's why it is coming up abnormal. So if it is timely treated, we can just prevent a complication. So if, for example, if you timely take precaution regarding heart, and if you are diagnosed with coronary artery disease, then we can treat it so that it doesn't progress, and then finally it leads to angioplasty or culminates into heart attack or bypass surgeries. So we can prevent those. So if your early detection is done, so do not be afraid to go to a doctor only on the basis that he or she may find out some disease or the other.
uh, Patients are worried mostly because, if, like you mentioned, if we go to a doctor for the testing, something may come out. But I think that is the wrong thinking. They are going to a safe place where if something comes up, there is a solution to it. You are going to safe hands. So they will treat you
Yeah.
well. They will make you healthy again. I think that is
So
one of the
okay.
mindset.
So even if you are not confident about that doctor, you can take a second opinion, but at least you are getting it checked. Okay, it is there. So if you don't want to take treatment, or you are in a doubt that he or she is just guiding you for treatment, you can have a second opinion, you can have a third opinion. So people are available for opinion. You cannot means it's not like you cannot take opinion. You are free to choose,
That
but
option is definitely available. Yeah.
not only going for diagnosis is not the right thing to do.
I think that is the biggest mindset change we require nowadays. As people go to doctor when something is wrong, I think nowadays focus should be changed towards the preventive side. Whether
Very
it is
true.
something or not, we need to go for regular checkup. We will not go to a doctor when something comes up. Regular checkup is something where it can be diagnosed at an early stage. And we might not need to get into that fear, that trauma. Oh, if this happened, that happens. I think slowly or gradually, I believe this change is coming up in the new generation, which is, that will take over. But I think that change is required
Correct.
the most.
Yeah, but newer generation, the sedentary lifestyle is again taking a toll on them, and
Definitely.
the smoking and bad eating habits, lack of night sleep, again it is troubling them. So because in IT section, many of them are used to working for night shifts, that is also taking toll on them, and stress, which we cannot forget, because they have to complete the tasks, they have to just targets achieve the targets. So I think these are the new nuisances of newer generation.
Those are some new addictions or intangible add-on factors which we always
Yeah.
neglect.
Yes.
So moving on, many people think that the heart disease or heart risk is inevitable if it runs into your family. So what do you think, or would recommend, how does this hereditary actually play a role compared to lifestyle factors?
So heart disease is a complex disease. It depends upon multiple factors. So it depends upon the age, sex of the person, then it depends upon the hereditary, then depends upon the uh, genetics, lifestyle, sedentary lifestyle or active lifestyle, dietary habits, addictions. So there are few factors you can change, few you cannot change. So the only factors that you can change are cultivate cultivating good habits, avoiding addictions, lifestyle changes like diet and exercise. Genetics, aging, you cannot change. So I think one should not be too much worried about those factors because they are not changeable. You cannot do anything for that. So if you have a genetic issue, you can control on some other factors. Na? There are six, seven factors. So you are only worried for one factor. Rest remaining factors you should control.
which
So
is in our
if you can
control.
control on those factors, so there is no need to worry for a single factor. People are like more okay, hereditary, but hereditary you will not be able to cope up with it. So yes, if somebody has a strong hereditary for heart disease, then they have to be extra precautious. They can start their lifestyle changes right from young means teenage. So prevent obesity, healthy lifestyle, exercising regularly, avoid addictions, and this is the only thing they can do for themselves, and this is, I think, it is enough, because there is only one factor which is at fault. Rest of the things you can manage.
Rightly pointed out, sir. I think we are thinking more about which is not in our control, but there 70
Yeah.
to 80% of factors which can be controlled. I think we should focus on that. So as we have come to end of our session, I would like to ask my last question to you, that if someone wants to start today, to start a healthy lifestyle. So, what could be your top three simple lifestyle recommendation changes that can really protect the heart in long run?
So only two things I will like to say. Please take a balanced diet. Don't be overdoing for any dietary recommendation. Just balanced Indian diet, and I think walking daily for 35 to 40 minutes for 5 days a week. If you are not comfortable in walking, you can have cycling, swimming, or any aerobic type of exercise. I think these are the two things which are best to maintain a healthy lifestyle. And definitely avoid addictions. Addictions are the worst. So smoking, for that matter, is worst of all.
Thank you so much, sir. And we cannot forget the importance of how you have said a lot of time in this conversation that how smoking addiction is so bad for our health. For heart, it could be our lungs, it could be any other organ. I think one of the biggest factor which is contributing to the younger heart attacks which we are seeing currently. But thank you so much on for this valuable insights and expertise which you have shared with us to motivate, to educate, and to aware our audience out there on this particular day of our World Heart Day. So thank you so much, sir.
So you can add that smoking doesn't mean only cigarettes. It includes everything. That those hookah joints,
Yes.
e-cigarettes, these are because it is very becoming rampant in the young generation. When the school going boys and college going boys, they are just using vaping, and they think that it is harmless, which is very, very wrong uh, marketing.
So
I
I'm not
think
sure about this thing, but the study came in that because of these vape have some kind of flavor, it is becoming more and more addictive. And since it can be done in a room, you do not have to specifically go to a
yes,
smoking zone. People
yes,
are consuming more of it, so it is being more addictive.
yes, yes, and it will be bane of the society in the long run. In the long run, people will definitely, it will have repercussions in the long run.
I think there are some many, lifestyle changes or these new habits which younger people are taking, which is, you know,
Yes,
kind of contributing globally for the heart attacks, specifically if compared to India. So, but thank you so much for stressing on that. Thank you so much that it putting a limelight onto it that we need to ban it or we need to stop it immediately to live a
yeah,
healthy, happy life ahead.
yes.
Thank you so much, sir.
My pleasure. My pleasure.
Thank you.